Well, good morning, everybody. Welcome to Nurse Mark and the Green Nurse Daily Dose of AFA,
where we bring you hope and inspiration for growth and healing so you can start your day off the AFA way. And in case you have forgotten,
well, you're absolutely fucking amazing, exactly as you are. Yeah. Exactly as you are. You don't need to be any better or different. You are it.
You're it. And guess who wrote a book about it? Mark. Let's just talk really quickly about the book.
Yeah, absolutely.
I think it's really important for people to understand that we talked yesterday about gurus, right? So this book is actually teaching you how to be your own guru.
Yeah. Yeah. Right? Well, you are your own guru.
That's exactly. Right. Yeah. Just to figure out how to make things work for you. And that's what I love is that you've experienced life in such a rich
journey. It's a journey going from despair to absolute joy.
Yeah. Can I tell you?
And how to get there.
And how to get there. And so we're here to tell you. Right?
Yes. 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 So Sherry, the heart. No, I can't do that. I never get it right. Oh.
The heart. So I want to just do a quick shout out to my daughter. Lauren Rose. I told her to watch today, and I'm not sure if she is, but I'll send her the video anyways. It's her birthday today. So my daughter Lauren's turning 19.
Birthday.
Yep. Happy birthday, Lauren. And the part that I just want to kind of bring up is that she was a baby that was born during 9/11. Okay. So this is interesting thing. I was pregnant with twins and I lost one of the twins while I was pregnant right after 9/11. And so I had to go on bed rest. This is just interesting and carry both a deceased baby and a live baby through the rest of my pregnancy. So the interesting thing, I know, right? That's kind of crazy. The interesting thing about that is that, so she's a twin and, we've come to process that information about her losing a twin. But the celebratory fact about her birthday is that, she went through 9/11. Her senior year was through the pandemic. So you just got to think about these kids and what they're going through, but how she's turning lemons into lemonade.
Yeah.
And that's what she's doing. So I just want to tell her I'm really proud of her. She is now a mailman. She's delivering mail, which I think is just, she's figuring it out. She's not ready to go back to school. So
that's
she's gotten it's just want to give a big shout out to my daughter and tell her how much I love her and how proud I am of her.
Happy birthday.
Happy birthday, Lauren. All right. So here we go.
26th, Friday. Okay. Let's talk a little daily love. It was short and sweet today. And it was about stretching, stretching yourself to grow. Like you do yoga, you stretch your body so that you're more flexible and able to reach a little bit further. But this was talking about stretching yourself spiritually, intellectually, taking on something that you've always wanted to do, but just never have. And I use the example of playing an instrument, right? You could just, if you've been wanting to play an instrument, do it. And, I'm inspired because my wife picked up the cello. She always wanted to do it. And she's like in the next room playing the cello.
I think it's great.
It's beautiful. It is. But that's it. It's about stretching and growing. So, whether it's taking a new class, learning a new language, just something.
Learning about cannabis.
Yeah, learning about cannabis. Exactly.
Stretch yourself, get out of your comfort zone and learn something different, something new, try something different, try something new. And guess what's so cool about that is that it's like a check box, a check mark after that thing. So it's the cool thing is that you never know if you're going to like something or not unless you've done it a couple times. It's the same thing as feeding babies with baby food. You stick a spoon in their mouth and they're like, but you really don't know if they don't like it or not until you've introduced it over and over again. Yeah. And so that's the same thing with everything. Like my first yoga class, I was like, what the heck? Upside down, downward dog. What the heck is all this all about? I'm on my head. I'm getting dizzy. Right. So at that particular time, it felt uncomfortable to me. But if I had given up, I never would have developed into a yoga.
Beautiful.
Exactly. So stretch.
Yeah. Stretch yourself today. And today is a great day to do that. There's no better day. It's the
No
only
better day than
Friday,
today.
February 26th, 2021 you're going to get. Start something new. Pick up a new instrument. Pick up a new language. Pick up a new partner. Hey, you don't
pick
know,
up
whatever.
a new bottle of pick up a new bottle of Nurse Mark CBD.
You can do that too. All right.
Oh,
okay.
All right.
So
Here we
stretch.
go.
That's my word of the day.
Awesome. That's good.
Stretch
And my word
today.
of stretch. So this is the part that's cool too, is complementary is my word of the day, because I am a big avid, you guys all know, advocate for cannabis. It's replaced my medications. It has given me my life back. I would never be where I'm at today without this plant. However, I must complement my holistic healing therapeutic tools with the traditional. So I can make sure. So I have to complementary. I need to go see the doctor again today, which is all good.
All good.
I have my handy dandy tools. And so complementary. So it's just really about remembering that it doesn't need to be one thing or another. You know, cannabinoids can bridge the gap from what we're not getting from traditional medications.
Yes.
Right. And that's going to lead into our topic.
It is completely. Drug interactions. Fun fact Friday. We love to talk about this kind of stuff, don't we, Sherry?
Oh, we do, because safety is of the utmost importance to us as cannabis nurses at the Green Nurse.
Yes.
You know, the goal of using cannabinoids is to use the smallest amount to get a perceivable effect below the threshold of feeling impaired.
Yes.
Okay. Right. So that's why we teach what we teach is safety. And we don't want people to start using cannabis having unrealistic expectations, taking too much. And we're going to get into that right now, because drug interactions could possibly happen.
Of course they could. Yeah.
So, you know what? Let's start at the bottom of the page. I think we'll talk about THC interaction and CBD interaction after we talk about the system and why it's important. What do you think? Cytochrome?
I love this. I just love chemistry and biology and the interactions. Oh, so today is a fun day for me. And
Fun Fact Friday.
About the Cytochrome P450 enzyme pathway. Yay! I bet you never knew you'd be doing this on a Friday morning.
CYP450.
Yeah, so it's in your liver. I mean, these enzymatic pathways are part of your liver function, and what they do, it's really amazing. When you ingest something, it passes through your liver. And when your body recognizes something that doesn't belong, like a drug, your body recognizes the drug. It says, "Oh, you don't belong here," and it puts it through the metabolic pathway to make it more water soluble, so that it can be flushed out of your kidneys. Yeah.
Fun Fact Friday.
Yeah. So the P450 enzyme group is responsible for metabolizing up to 60 to 70% of the drugs that we take. That's recognized, the liver recognizes it and tries to get it out. And so there are things like first pass effect, right? Yeah.
Yep. The first pass effect.
Sherry, I mean, first pass effect. You know what it is?
Yes, but I want to, I want to get into a little bit. Can we get into that just a little bit bit later? Just because
dive deep.
No. Yeah. I want to dive just a little deeper, because it has to do with how and when and how much you consume, when you're taking in orals and edibles and capsules and sometimes even tinctures. It just depends if the tincture doesn't get absorbed into your mouth. So when we talk about the CYP450, why does it matter? So this has to do even with traditional. So in traditional, it's helped to determine dosages of traditional medication. So doctors make calculations using the average amount of time it takes for various drugs to be processed through our body and through that system. So if only one drug is being processed in the system and the person is generally healthy, these averages provide accurate dosing information. But if someone doesn't have a healthy endocannabinoid system, if someone's getting older, if they're on multiple medications. So if you're taking 5 or more medications, there's a 50% chance that your drugs are interacting. If you're taking 10 or more medications, there is 100% chance that those pharmaceuticals are interacting, and probably not in a way that's benefiting you.
And by the time you're in your 60s, you're probably on average 5 to 7 medications.
Yeah, exactly.
That's the stat.
Yep. So, Mark.
Yes, ma'am.
We talk about THC and CBD in whole plant medicine.
We do.
And the one that, that's interesting, the one that inhibits the cytochrome P450 system the most is CBD. Right?
It is. Yeah.
And the reason why. The reason why is because what it does is it's impacted in the way. So when CBD is present, right, what happens is that the circulating pharmaceutical can circulate longer in your system. So it either speeds up the metabolism of the drug or slows it down, right?
Right. Depending on if the drug is active before it's metabolized or after, because some drugs actually need to go through that P450 enzyme route to turn into the drug that's active in the body. Do you know what I mean? So we never know. Each drug's going to be different. Yeah.
So that's just an example with folic acid. If you don't have a way of getting folic acid into your brain, it converts, once it comes in, it converts into something else. So then it can get to the area that it needs to go, needs to cross the blood-brain barrier.
Yeah.
So really kind of cool. So the other thing too that's really cool too is that a lot of people don't know is that CBD is not alone in its effect on drug metabolism. So there's a lot of grapefruit. Have you ever seen a prescription bottle that says, don't take with grapefruit? Well, it's very, very similar. They have a similar impact in terms of how the cytochrome P450.
The same reason, exactly. It'll affect those other drugs, either raising them or lowering them.
Yeah. All right. So safety with THC and CBD, and then I'm gonna let you share about the first pass effect, because I think you are currently in the master's program, so I'm sure you have a different perspective than mine.
You have tons of knowledge. Knowledge is knowledge.
Knowledge is knowledge.
I've been in the healthcare space a long time, and so have I. I've been a short time, but I've been in school a long time. Feels like.
Oh, Mark,
so we got knowledge, baby.
we got skills. Yeah.
Oh, yeah.
So there's a lot of times what comes up too is with dosing. And, we've talked over and over and over again that dosing is personal. No two people are the same.
Right.
The cannabinoid requirements can change over time as you change. And so what's important about dosing, number one, is that if you have a lot of medical problems and you're on a lot of pharmaceuticals, is you should be working with a clinician. That's number one.
Yes.
So THC interaction with pharmaceutical drugs. We got this from Cannakeys.
Yeah.
And I'll do THC, you can do CBD. How's that?
Got it.
All right. So THC can enhance the effects of drugs that cause sedation and depress the central nervous system. And that's benzodiazepines, barbiturates, narcotics, opioids, and alcohol, for example. So the thing that's important with that is that sometimes, we as clinicians teach and educate patients the best time to take their products around their pharmaceuticals. Do you want to take it 2 hours before, 2 hours after, or at the same time? Right? So THC is metabolized by inhibitor in a bunch of different enzyme liver pathways that are related to that cytochrome P450 system. So just think about this. There's over 50 enzymes. 50, that's a lot.
Right.
In this enzyme cytochrome P450 system. And it's responsible for the breakdown of those drugs, like we said, antidepressants, antipsychotics, beta blockers, Coumadin. And so if patients are taking these classes of medications, they may find that the THC is going to increase the concentration and effects of these drugs as well as the duration, right? So think about that. You're using medications, you're adding cannabis. And that is why oftentimes patients are able to come off of pharmaceuticals is because, or decrease their dose anyways, because they're able to bridge the gap, the other circulating pharmaceuticals circulating longer in their body. And so they're able to decrease the dose. And I've seen that with patients with Coumadin, which is really interesting, and not in a dramatic way. So what the studies have shown is that clinical observations suggests that there's no likely interactions with other pharmaceuticals at a daily dose no more than 20 milligrams of THC. So
Right.
we're not saying, so basically I just want to rephrase that. We're not saying that you can do 20 milligrams of THC a day. What we're saying is the clinical you could
get much done. I don't know. 20 milligrams for me is on the outer edge of I'm getting a box of popcorn and sitting on the couch and watching a movie. Like,
do you want to laugh? So here's the difference between Mark and I. So here it is we're going to start the different view reviews. Joe, if you're out there, I love you.
Oh, the different view reviews coming up.
So the different view reviews, exactly. So just think about this. So Mark, if he did 20 milligrams of THC at one time, what would happen?
Man, I am not interacting with people much. I'm really, really happy and I'm really tired.
Okay, so you ready for this?
The outside edge for me, right?
Yep. So here's the thing that's interesting is that I need higher doses of THC. So I probably medicate with between 50 and 80 milligrams of THC a day.
Yeah.
Boom. But I'm not impaired. I balance it out with the rest of the cannabinoids. Right. And basically it allows me to function in a way that's appropriate. So I know how to make myself more elevated. All I do is do more THC than CBD because I know my ratio. I know how this plant interacts with my body.
Right. Right.
And so basically, and if you ever do overconsume, we don't want anyone to overconsume and have a bad reaction. So it's just, if you do, there's tips and tricks that we can talk about after we go through CBD interaction with pharmaceuticals. So THC is awesome. It unlocks the door to the largest neurotransmitter signaling system. But as clinicians, we want people to start low and go slow. And really, if you have chronic debilitating illness on multiple pharmaceuticals, you should connect with a clinician such as us.
Right. Like the green nurse. Now, here's the thing, everything that we take in, we smoke or we eat or we drink, it has a potential effect on all of the other things that are going on. So when we talk about drug-to-drug interactions, people are really focused. A lot of research is focused on cannabis and drug-to-drug interactions. That's good. But you got to understand these other drugs that we take may not have been put under that same microscope of drug-to-drug interaction because they just get to the qualification threshold and then they're authorized to be used. So I think it's good that cannabis is under the microscope. Literally.
Me too.
I
think it's what is it all about?
That when we talk about, I'm sorry, Sherry.
No.
When we talk about these things, we're saying, yes, let's look at it and be cautious, but understand what we're finding out is that it is a very positive medicine, cannabis.
Yeah.
Very high safety. And very good effect. So, take that for what it is worth.
Because and Mark,
go ahead, Sherry.
And the thing, we can just even give an example of working with clients. A client that contacted us, wanted information on what to take right here, right now. And what was he on? A ton. He just had a heart attack, right? So he, on a ton of medications. Was interested in using cannabis, but wanted us to just give him random advice on how to do that. And we can't do that as clinicians. It's about risk benefit ratio, educating on the endocannabinoid system and looking at every single thing that a patient's doing or not doing in their life. And even having the discussion, is your traditional physician know about this?
You need to. We always give that advice. Really, listen, you have to loop everybody in who's on your healthcare team. Everybody's got to know what's going on.
And if you have a hard time talking to your doctor, I'm just here to tell you that we're not afraid to talk to your doctor.
No.
We'd be more than happy to pick up the phone and
always
just have a conversation.
Yeah. Spread the word.
Spread the word. Right. Okay, Mark, you're on CBD.
Woo! So CBD is, the one that has the higher possibility for drug-to-drug interaction because it does take up that P450 enzyme group. Certain ones, as you said, Sherry, there are many within that group, and CBD happens to have a high affinity, which means it latches on very nicely and stays there. And the rest of whatever you need to metabolize, the drugs that you take, may not have an opportunity to get in that pathway and be converted. Right. So Sherry, it's it may alter action on metabolic enzymes, right? It's what I said. So it may be therapeutic or it may be adverse effects. Like you noted, Sherry, that in some cases, patients can decrease the pharmaceuticals that they're on. And that's a therapeutic effect, right?
Yep.
Adverse effect, maybe it raises those levels
Right.
where they're not good for the body.
Right.
Yeah.
Absolutely.
So, so there are, as we talked about, there are different enzymes within the group. And so
so many.
there are
Like
specific ones, the cytochromes. So there's 2C19 and 3A4, and that's what CBD interacts with, and THC interacts with some different ones. So it could increase the bioavailability of anti-epileptic drugs or benzodiazepines as well.
Yep.
So you just need to be aware of what you're taking in and when you're taking it, really.
Yeah. And like specifically for epilepsy, you need to think about it. A lot of times there's certain epileptic drugs that they want within a specific range. So they actually monitor, they take the blood from the patient to see if that pharmaceutical is within the therapeutic range circulating in their system. So that's why, it is really important to work with a clinician. We want everyone to have access to this and to benefit from it.
Right. There's drugs that we do that with, right? I mean, warfarin, the one that you mentioned, Coumadin, it's a blood thinner, needs to be in a very tight range. And someone who's on lithium, if someone's bipolar and they're on lithium has to stay within a certain range in your blood, right? So a lot of different ones. So that's why you need to just be aware. And I think I told this story. Did I tell this story earlier? Yeah, I did. Told him a story.
Which one?
My friend who was taking cannabis and knew I was in the industry. We hadn't seen each other in a long time. We went and had lunch, and she put them all out on the table, and she said, "Oh, I'm doing this one and this one and this one." And I said, "Well, what else are you on?" Well, because I know she's diabetic and has some issues. And she said, "Well, I'm on warfarin and metformin." And I said, "Warfarin, really?" She says, "Yeah, but my levels have been really crazy in the last few weeks. I don't know what it is. Like the doctor, we can't figure it out. It's up, it's down." I said, "Oh, I'm so glad we had a chance to meet and we had that conversation, right?"
Yes.
I think I told that story earlier this week, but it bears repeating because she had no idea and she was just sold the products. And
so the interesting thing too, so people can understand, why is it dangerous to have elevated Coumadin levels? So they call it PT-INR. That's how they measure how thin the blood is. So if you have really elevated numbers, you are at risk for bleeding. Right. So just imagine, like, if you fall and hit your head, you cut your, you hurt yourself. So that's the concern is, too high of levels, having issues with not being able to stop bleeding because it's an anticoagulant. It stops clotting. And a lot of people take that, for cardiovascular health, if they have cardiac arrhythmias, if they have blood clots. So there's a lot of different reasons why people might be on Coumadin.
Yeah. And on the other side, if there's not enough of it and the blood is not as thin as it needs to be, that's the issue that they're trying to resolve for blood clotting and other types of things. Yeah.
Yes. So safety, right?
Always.
So, we love cannabis, but number one is about your safety and your ability to be educated and to learn how to make this plant work for you. So the goal, like we had said earlier, is to take the lowest dose to get the most therapeutic response. That is achieved by what? Starting low, going slow.
Right. Yeah.
Microdosing small amounts throughout the day to mimic your own endocannabinoid system. Incorporating other endocannabinoid system promoting activities. All of the things that we talk about. And then working with cannabis specialists, cannabinoid, I call them cannabinoid therapists.
Clinicians.
Yes. So people that know and understand how the endocannabinoid system works, in the know.
Yeah.
So I have a handy dandy little list. I'm putting my glasses on so I can be smart. So basically, why would someone possibly want to have a consultation? I'm going to give you a couple reasons why. And if you answer yes to any of these questions, basically, it's seeking a nurse consultation is definitely going to help you, and it's going to ensure optimal medical cannabis use. So do you want a personalized, individualized approach to optimize your cannabis results? Are you seeking medical cannabis for a child or adolescent? Do you want to reduce your reliance on pharmaceuticals? Are you on multiple pharmaceuticals? Have you been diagnosed with cancer? Do you have a cardiac or respiratory problem? Do you have a mental health disorder? Are you seeking to use cannabis to manage and improve a complex medical condition? So basically, all of those things, if you answered yes to any of them, we recommend, if you want to get your results quicker and you want to learn about this and learn how to incorporate it and do it safely, reach out to a cannabis clinician, and I'm going to let you know we're here for you. We're here for you. So visit us at www.thegreennurse.com.
And, you know, I just love seeing people show up. Thanks for showing up, everybody. It's always good to see your names pop up in the stream. It really is, because you're part of the community, and that's what the Green Nurse is. It's a community,
and we're getting bigger. We're expanding, right?
We're all in this together, and you know, there's a lot of knowledge out there that we can all, you know, just be as knowledgeable on this subject as possible to help people use it safely. And that's what today's talk was about. Really, is about safety. So join us in the community. We'll get this done together.
Yes. And I'm going to plug Joe. I don't know if you're out there, but if you are, please say hello. So I want to just plug our new series that's going to be coming out. Yeah. In the Weeds, Prohibition Talk radios every Wednesday from 4:20 to 6:20 p.m. And Mark and I have a segment on there called Canna Talk, which we are really grateful to be able to do, because we're bringing those hugs and nugs of information, you know. And then we're doing Terpene Tuesday for In the Weeds Prohibition Talk Radio. So we're talking about terpenes, what they are, specific terpenes, how they work in the body, and how they interact with the endocannabinoid system and other cannabinoids. And then we give examples, which is really fun. So the new thing that we're doing, which I think is so cool, is because, you know, you have, when people ask, how do you use, you know, is cannabis medical or recreational? And I always say it really has to do with your intention. When it comes into your body, it acts as a medicine.
Right.
However, it's more intention. So, you know, people have asked about the difference between medical, the difference between recreational, adult use, and all of that. So we're going to address that in a new show. Ready? It's going to be In the Weeds and the Green Nurses. And the name of the show is going to be The Different Views Review. So you think about, and Joe is DJ Joe and the Green Nurses. And so we're going to be talking about specific products, looking at them, evaluating them. Is this a good medical product? Is this a product that's going to really improve my health and wellness? And then looking at the different things that we look at as clinicians. And then Joe is going to look at it from an adult use perspective. Why would someone want to purchase this as an adult use product? And then we're going to combine it. Could this be used both medically and as an adult use to create an experience? So I think it's going to be really fun. And the part that's even better about it is because Nurse Mark and I, you know, we're both nurses, we're both clinicians, we're both patients, but we have two different perspectives. And so being able, yes,
everybody's got their opinion.
Everyone's got their opinion.
And they're all valid.
And they're all, exactly. And so that's what we want to do, is we want to bring you information, more information, you know, so you can be educated and just really learn about products and how to make choices.
Yeah.
All right. One last plug before we wrap it up. So this morning in the Green Nurse community, Nurse Carrie Lee, Nurse Michelle, and Nurse Denise, I'm hoping will join us. And we're going to be doing an energy healing demonstration. We're going to be talking about Reiki, reconnective healing, and Healy. So, and we're going to talk about what that means, and then just give you all a little sample.
Nice.
Yeah.
Beautiful. Love it. And today, an AFA day, baby. Stretch.
Stretch. Compliment yourself. Complementary therapies.
That's right. So, Sherry, what's it all about?
Oh, Mark, you've taught me so much about being AFA, and basically being AFA helps me to live my best life.
Yeah. Everybody have an awesome Friday. Thanks for stopping by. Have a great weekend. We'll see you at 9 a.m. this morning. in Monday morning at 8 a.m. Thanks.